Epilepsy in pregnancy. Epilepsy, seizure disorder, or Mirgi is a neurological problem which affects or has a prevalence of 0.5 to 1% in pregnancy. What we need to understand is that most of the women with epilepsy who are regularly taking their medications will have a normal pregnancy, will not have a seizure in the pregnancy, and can have a vaginal delivery, that is a normal delivery, and will have a normal and a healthy baby. Pregnancy in epileptic women should be preferably a planned pregnancy. A planned pregnancy means a patient who is on medications for epilepsy should visit her physician or her neurologist before she is planning a pregnancy, so that if some medications are to be changed, will be changed, because not all anti-epileptic medications are safe in pregnancy. Like sodium valproate is a medication which is commonly given for epilepsy but is not advised to be taken in pregnancy. So the lady needs to visit her obstetrician and neurologist when she plans a pregnancy, needs to change her medication, and should start 5 mg of folic acid, preferably 3 months before planning a pregnancy. Because a seizure problem should be controlled, because the main factor which is responsible for a pregnancy free of seizure is having a 1 year duration before the pregnancy free of any seizure episode. But if a lady accidentally gets pregnant, it is not an indication to terminate or abort the pregnancy. What she needs to do is that she needs to visit her obstetrician or her neurologist immediately to change the medication if needed and to start folic acid. Once the pregnancy is planned and the lady is pregnant, what is important is that she should never miss her medication. During the pregnancy, there is very rare chance of having increased risk of seizure episode. What is important is taking regular medication without missing your medication and taking folic acid. During pregnancy, the lady will have to have more visits to her obstetrician, will need a regular routine level 2 or an anomaly scan at 18-20 weeks, a fetal echo at 22 weeks, but would require more frequent ultrasound for the growth monitoring of the baby. During pregnancy, a lady with epilepsy should never miss her medication, should never be alone anytime in the house, and if has more episodes or has frequent episodes of epilepsy or any episode of seizure in pregnancy, she needs to visit her neurologist to increase the medication. Then comes the question of labor. During labor, there is definitely more chance of having an episode of seizure because of fatigue, tiredness, lack of rest, and most importantly, pain. Pregnancy with seizure is not an indication for going for a cesarean section. A lady can very much try for a vaginal delivery, but what is important is to reduce the pain, that is labor pain perception in the time of labor, by taking or opting for a painless delivery. The most important phase is the post-delivery phase, in which family support is very important, because this is the time when there is maximum chance of precipitation or having seizure episodes. Reasons being lack of rest, lack of sleep, tiredness. The lady is busy with the baby and has more chances of missing her medications, which again predisposes her to having an episode of seizure. Some precautions are very important in the post-delivery period is that a nursing mother should never be alone. She should have some company all the time, should have adequate sleep and adequate rest along with balanced healthy diet, should continue her medications as taken during the pregnancy, and should nurse the baby in presence of some help. And nursing of the baby should preferably be on the floor. And whenever a lady has the aura or symptom that she is going to get an episode of seizure, she should immediately put the baby down. The most important question a lady with epilepsy or a seizure disorder asks is, will my baby have this problem? In this case, the family history is very important, because if the disorder runs in the family, then definitely there is some risk of the seizure disorder happening in the baby, for which she needs a genetic consultation. But otherwise, the risk of having epilepsy in your baby is very, very rare. So the key important points are regular visit to your neurologist and obstetrician, never missing your medication, ideal rest, and during labor you should opt for painless delivery, that is epidural analgesia. And in the postpartum period, a very good family support is required. And above all, breastfeeding is not contraindicated if you are taking anti-epileptic medications.